Since the Supreme Court overturned Roe v. Wade last year, 14 states have banned abortions in nearly all cases. Many maternal health doctors say state abortion bans are untenable for them and their patients. From Tennessee to Texas to Idaho, OBGYNs are beginning to pack up and leave. In a segment co-produced with the PBS NewsHour, KFF Health News correspondent Sarah Varney reports on this growing crisis.
Over beers at a local Sandpoint, Idaho brewery, residents held a wake of sorts.
My fellow doctors, my nurse anesthetists, you've all been a family to me for 14 years.
To mourn the closure of the labor and delivery ward at Bonner General, the city's only hospital. The hospital in part blamed Idaho's legal and political climate. Quote, highly respected, talented physicians are leaving. Recruiting replacements will be extraordinarily difficult. The closure comes just 8 months after Idaho's abortion ban went into effect. Except in cases of police-reported rape and incest, physicians can only perform the procedure to, quote, prevent the death of a pregnant woman.
One of the most strict bans across the country.
Dr. Amelia Huntsberger has delivered babies and treated miscarriages at Bonner General for more than a decade. But soon after abortion became illegal here, she saw a patient with a ruptured ectopic pregnancy, a fertilized egg that grows outside the uterus.
We needed to move quickly to stabilize her and to save her life. When I got to the operating room and I removed the ectopic pregnancy, which at that point was problematic legally, I knew that I needed to do what my oath requires me to do to prioritize the safety of my patient. And I also knew that I was putting myself, theoretically, potentially, at risk of felony charges, which would have a minimum of 2 years in jail, loss of my medical license for 6 months.
Dr. Huntsberger and her family have decided to leave Idaho.
This isn't a safe place to practice medicine anymore.
The law has since been amended to allow for terminating ectopic or molar pregnancies, a rare complication caused by an unusual growth of cells. But Dr. Huntsberger says it still doesn't account for many common pregnancy complications that can escalate quickly.
For instance, there's something called an inevitable abortion, meaning the cervix is open, the pregnancy is going to pass, but has not yet. You could have a woman bleeding heavily, and yet there still might be a heartbeat. When is it okay for me to act? Can I just say, this, without treatment, is really risking her life and I should act now? Or do I wait until she bleeds out? Do I wait until we do CPR? When is it that I can intervene? How close to death does she need to be before I take care of her in the way that I trained years to know how to do?
You know, Hope's kind of at the base of those mountains with snow on them.
State Representative Mark Sauter, a Republican, lives in Sandpoint. He says he hadn't thought much about the abortion ban.
It really wasn't up high on my radar other than I'm a pro-life guy and I ran that way, but I didn't see it as having a real big community impact.
Then he started talking with local doctors, including Amelia Huntsberger.
What I'm wondering is, for you personally, did you think about abortion as it relates to obstetric care for pregnant women?
No, I don't think you know, it's like anything. You get exposed to something, all of a sudden you go, wow, there's a different way to look at this. You know, what are we going to do about all this?
So is Bonner the canary in the coal mine here?
It could be.
With Sandpoint's maternity ward closing, Representative Sauter supported a bill that would have allowed doctors to terminate pregnancies to protect a woman's health, not just prevent her death. But that effort was shot down by other Republicans.
The list was endless when we began considering the conditions that could fall under that language. We want to make sure that health of the mother doesn't become so broad that everything becomes an exception to take the life of a potential child.
I think it sends a really powerful message to the citizens of Idaho that the legislature doesn't think that the protection of the health of pregnant patients is important.
Far to the south, in Boise, Dr. Lauren Miller resigned from her position at Idaho's largest hospital last month. She's been forced to send patients out of state to end dangerous pregnancies, including a woman with a serious kidney disease.
I could have very easily taken care of that patient along with my partners. We have the team on the ground, we have the kidney specialist, we have the intensive care unit, but instead she had to leave her family and fly several more hours away to receive care in an expeditious time frame. It's just not what we signed up to do.
You've been working under these laws for many months now. Why now? Why did you decide to resign?
Yeah, it's no one single factor. It's kind of the conglomeration of all of the legislation that has been passed this session.
On top of the abortion ban, she blames lawmakers for failing to extend postpartum Medicaid coverage and failing to reauthorize a committee of experts that investigates pregnancy-related deaths. A recent survey found that about 40% of Idaho's OBGYNs are considering leaving the state. That will affect women who rely on OBGYNs for routine and urgent gynecological care unrelated to pregnancy, like menstrual disorders, endometriosis, and pelvic pain.
There's no official nationwide count yet, but OBGYNs and maternal fetal medicine specialists from states across the country where abortion is criminalized are beginning to relocate to places like Washington State. Here in Seattle, physicians can care for patients without fear of prosecution.
Is there anyone that you're worried about on the afternoon schedule?
Dr. Sarah Villarreal is an OBGYN who moved to Washington State last summer from Texas. There, she had to practice under a state law that allows private citizens to file civil lawsuits and earn at least $10,000 against anyone who aids or abets an abortion. In Texas, performing an abortion is a felony punishable by up to life in prison.
Even if we did nothing, even if someone just accused me of breaking the law and I had not actually done anything wrong, I could still have to go through, the court system and, go to court.
She says there's an atmosphere of fear and distrust at many Texas hospitals.
I had a patient who I saw in the emergency room who was actively having a miscarriage, and the fetus still had a heartbeat, and it was a desired pregnancy, but at that point she was losing a lot of blood to the point that we were worried that it was going to be threatening to her life. She was trying to figure out if me as the provider was going to report her for if she did decide that she wanted to do a D&C procedure to save her life over the life of her fetus versus asking me questions about her own health care.
Even medical students are beginning to change their plans. This year, applicants to OBGYN residency programs decreased by 10.5% in states with total abortion bans.
It can spread to the whole lung.
And those pursuing other disciplines are taking notice, too. Catherine Tiger and Allie Ward, first-year medical students in Moscow, Idaho, are planning to become surgeons. They spoke to NewsHour in their personal capacities.
Do you imagine yourselves ever being able to work here in Idaho?
I personally don't, and I wouldn't feel safe here as a provider, and I wouldn't feel safe here as a patient.
So you're not planning on pursuing OBGYN. Why do you think that these laws will affect you?
Medicine in general is such an interdisciplinary capacity, and you have to be able to refer and collaborate. It's terrifying to think that I wouldn't be able to refer a patient who was seeking care or even just education to a colleague of mine that I trusted because of the laws in place.
How far can you throw it?
Back in Sandpoint, Dr. Amelia Huntsberger and her family are saying their goodbyes to Idaho.
And so it's heartbreaking to me to think about what it will mean for a woman experiencing a pregnancy crisis, a pregnancy complication, an emergency, who will now be many miles away from an OBGYN, many miles away from a facility that has the staff to stabilize her.
Sandpoint isn't the only city in Idaho to lose a labor and delivery ward. A hospital in Emmett, north of Boise, recently announced that it, too, will stop providing services for expecting mothers. For the PBS NewsHour and KFF Health News, I'm Sarah Varney in Sandpoint, Idaho.